Well, thank you, Sarah. Over this past period of time, we have been saying that there will be clusters appearing over Northern Ireland. It's how we manage those clusters that really matters. And last evening, myself and the Deputy First Minister had a meeting with the Chief Medical Officer, the Chief Scientific Advisor and the Minister for Health around how things are going at present. We are concerned about the Armagh, Banbridge and Craigavon Council area. The numbers seem to be rising there, as indeed they are in Belfast. You'll recall a couple of weeks ago, Mid and East Antrim was an area of concern. That now seems to be falling back, which is good news. So it's how we manage these matters. We are keeping a close eye on what is going on, and it's important that, as always in COVID-19, that we work in partnership with the public in the different areas, and of course, in this particular instance, with the Health Trust to try and eliminate what is a cluster in the Craigavon area.
I'm just wondering when it reaches, as I sort of asked Mr. Devlin, a tipping point in which you'll have to introduce new measures or new regional lockdowns.
Well, I think the first thing you have to do when you see a cluster developing is find out what is the source of that cluster. It appears that, unfortunately, this cluster seems to be associated with the hospital, so it's important that we work with the hospital and the trust to try and deal with the problem as it arises. In other cases...
True. Interestingly, though, he told us that he doesn't believe the three are linked to each other. Yes,
and that's something of concern, so we need to get on top of that. In other cases, as you know, we've had incidences in food and meat plants. And then one of the things that we are concerned about, and you've seen this in Scotland, and the reaction to that is people meeting together, principally in their own homes. And that is why the Scottish Government has taken interventions in Glasgow to try and limit the spread in the community over there. So it's about trying to find the source and dealing with it in the appropriate way. And it's important that we have targeted interventions so that we can avoid a so-called lockdown, which of course we all want to avoid at all costs.